Hello students, welcome to my mental disorders class. My name is Satwika and I'm your lecturer for this class. So in this video, before we dive more into the classification and symptoms of mental disorders, we're going to talk about the introduction part of mental disorders first. Okay, so we will refresh some theories that you've been studied in the past about psychology related to mental disorders. So let's take a look what's on our plate today. I believe that you've seen the prologue video just now, right? And you might have several questions dancing in your head after watching the video. And what happened in the reality sometimes might differ from the textbook, right? And learning from the video, do you suggest that crisis sickness is a psychopathology? Are you sure? And by what evidence you conclude your arguments? What is actually psychopathology and the science behind it? What are the, let's say, like the historical conception of abnormal behavior and normal behavior? So in this lecture, we will flash back to track the old views of psychopathology from the supernatural tradition to the science method and an integrative method of psychopathology. Okay, so first of all, what is psychological or mental disorders? When a behavior considered normal or abnormal. So briefly, psychological disorder is a psychological dysfunction within an individual, right, that is associated with distress or impairment in functioning and a response, of course, that is not typical or atypical, yeah, or culturally expected. Okay, so let's review some of those key points in that definition. So psychological dysfunction here refers to a breakdown in cognitive, emotional, or behavioral functioning. So for example, if you're out on a date, it should be fun, right? But if you experience severe fear all evening, you're like frightened and just want to go home, even though there's nothing to be afraid of. And that fear happens on every date, every single date. You feel a very intense fear. So your emotions are not functioning properly, right? So you cannot enjoy your date there. However, if all your friends agree that the person who asked you out is unpredictable and dangerous in some ways, then it would not be dysfunctional for you to be fearful and avoid the date. So you see the difference here, right? And the next one, a behavior that considered a abnormal one, is that the behavior must be associated with distress. So the criterion of abnormality is satisfied if an individual is extremely upset. But remember, by itself, this criterion does not define abnormal behavior too. So because it is often quite normal to be distressed, right? So for example, if someone close to you dies, the human condition is such that suffering and distress are very much a part of our life, right? This defining psychological disorder by distress alone doesn't work, okay? So also the concept of impairment is also useful, although not entirely satisfactory to categorize someone with mental disorders. So for example, many people consider themselves shy or lazy, right? But this doesn't mean that they're abnormal, okay? But if you're so shy that you find it impossible to have a date or even interact with other people, and you make every attempt to avoid other people, even though you would like to have friends, right? So this means that your social function is impaired. And finally, the criterion of abnormal, that the response should be atypical or not culturally expected. Okay, so not culturally expected is important, but also insufficient to determine whether it is abnormal or normal. Okay, so at times something is considered abnormal because it occurs infrequently, right? It deviates from the average. Okay, so the greater the deviation, the more abnormal it is. And many people are far from the average of their behavior, but few would be considered as disorder, considered as having mental disorders. We might call them talented or eccentric in other way, right? So many artists, movie stars, or athletes fall into this category. So for example, here, it might not normal to plan to have blood sport from your clothes, but when Lady Gaga did it, while she performed, it only enhanced her celebrity, right? Therefore, deviating from the average does not work well as definition of abnormal behavior. So another view is that your behavior is abnormal if you're violating social norms, okay? So this definition is useful in considering important cultural differences in a psychological disorder. So for example, to enter a trance state and believe that you're possessed reflect a psychological disorder in Western countries, in many Western cultures, but not in other societies, including in Indonesia. Okay, so some religious behavior may seem unusual to us, but are culturally or individually appropriate for certain cultures, as you can see in these two pictures here. So that's why, according to the DSM-5 or the Diagnostic and Statistical Manual, yeah, it describes mental disorder as behavioral, psychological, or biological dysfunctions. Okay, so the dysfunctions first that are unexpected, and their cultural context. Okay, so this criteria should be there and associated with present distress. Okay, so the person should feel distressed, experience distress. Also impairment, okay, impairment in their functioning, or the increase of risk of death and pain that also occurred in their symptoms, right? So this definition can be useful across cultures and subcultures if we pay careful attention to what is functional and dysfunctional in a given society. Okay, but it is never easy to decide what represent dysfunction actually, and some scholars have argued persuasively that the health profession will never be able to satisfactorily define disease or disorder, right? So the best way that we may be able to do is to consider how the apparent disease or disorder matches a typical profile of a disorders. Okay, so in this case, based on DSM-5 and other diagnostic tools that we will learn in the next classes. So, all right. There are three major categories make up the study and the discussion of mental disorders. So let's take a look here. The first one is describing a patient presenting problem is the first step in determining her clinical description, right? So the clinical description represent the unique combination of behavior, the thoughts, the feelings that make up a specific disorder. So the word clinical refers both to the types of the problems or disorder that you will find in a clinic or a hospital, and to the activities connected with assessment and treatment for this person. And the second one is the etiology or the study of origin. It has to do with a disorder begins or what causes it, and it includes biological, again, psychological, and social dimension. And the next one is the treatment. Treatment also, it is important to study of psychological disorder because let's say like if a new drug or psychosocial treatment is successful in treating disorder, it may give us some hints about the nature of disorder and its cause. For example, if a drug with a specific known effect within the nervous system alleviates a certain psychological disorder, we know that something in that part of the nervous system might either be causing this disorder or helping maintaining it. All right. So now let's briefly overview the historical conception of abnormal behavior first. Here we will see like three models. The first one is the supernatural, the biological, and the psychological. These models are very old actually, but continue to be used today. Okay, so let's talk about the first, the supernatural tradition. So humans have always supposed that agents outside our bodies and environment influence our behavior, also influence our thinking, our emotion, etc. And these agents, according to supernatural tradition, which might be a demons, spirits, or other phenomena such as magnetic fields or even the moon or the stars, right? So those are driving forces behind the supernatural model. So with a perceived connection between evil deeds and sin, or the on the one hand, and the psychological disorder on the other hand, it is logical to conclude that the sufferer or the patient is largely responsible for the disorders. So which might well be a punishment for evil deeds, for example, like that. So in the Middle Ages, if exorcism failed, some authorities thought that steps were necessary to make the body uninhabitable by the evil spirits, and many people were subjected to confinement, beatings, and other forms of torture. And another fascinating phenomenon is characterized by a large-scale outbreaks of bizarre behavior. And to this day, these episodes puzzle historians and mental health practitioners, actually. So mass hysteria may simply demonstrate the phenomenon of emotional contagion, yeah, in which the experience of an emotion seems spread to those around us. And when this kind of experience escalates into full-blown panic, and the whole communities are affected. So in the popular language, this shared response is sometimes referred to as mob psychology. So my question is, tell me your opinion based on your knowledge. Does a supernatural tradition in seeing mental disorder remain used in today's world? Okay, so mention some find and mention some of the example from our cultural phenomenon. Do you ever heard cases of people in Indonesia experience mass hysteria or trance or possessed by demons? And how is the cure or treatment for curing this kind of people? All right, so let's move on to the biological tradition here. So physical causes of mental disorders have been sought since early in the history, and according to the biological tradition, abnormalities is closely related to organism dysfunction and needed physical care and cured by medical, especially drugs. So one of the most interesting and influential legacy is the Hippocratic Galenic approach, which is the humoral theory of disorder. Okay, so Hippocrates assumed that normal brain functioning was related to four body fluids or humors. Yeah, you can see here. And so the physician believed that this disease resulted from too much or too little of one of the humor. Okay, so for example, too much black bile was thought to cause the melancholia or depression. Okay, and the terms here from the four humors are still sometimes applied to personality traits, as you can see in this slide here, okay, and still be used until today, that you might read from the popular article or somewhere. And then later in 19th century, a medical doctor, John P. Gray, underlined that the cause of insanity were always physical. Therefore, the mentally ill patient should be treated as physically ill. All right. And then the psychological tradition. So the psychological tradition actually lay dormant for a time, and since the era of Plato, right? And only to re-emerge in several different schools of thoughts in 20th century. Here are the first major approach was psychoanalysis, of course, based on Sigmund Freud's elaborate theory of the structure of the mind and the role of unconsciousness processes in determining behavior. And then the second one was the behaviorism associated with John B. Watson and Ivan Pavlov and B.F. Skinner, which focused on how learning and adaptation affect the development of psychopathology. And of course, the humanistic theory also developed for the psychological tradition later. So the further discussion about the psychological tradition will be continued in the next video. And thank you for attention. I'll see you again in our next video.